My name is Dr. Chantae Sullivan-Pyke, and I am a reproductive endocrinologist. In my practice, I help patients understand what's happening to their bodies as it relates to reproduction and options they may have to conceive. Let's define IUI. What is it? Intrauterine insemination. A provider puts a speculum in the vagina, just like we do for a pap smear. We take a sample of processed sperm in a little catheter and put it into the cervical canal into the uterus at the expected time of ovulation. It's simple and it's straightforward. And this procedure helps to improve a couple's chances of getting pregnant by getting the most highly active sperm near the fallopian tubes. The sperm will then swim into the tubes where fertilization can occur. The great news is risks are minimal. Patients may experience minor discomfort with the placement of the speculum or the insemination catheter. They may also have some spotting after the procedure or cramping. As insemination is typically combined with a medication that stimulates the ovaries to ovulate more than one egg, there's also a risk of multiples. However, in the typical patient with unexplained infertility, the risk of twins is about 8 to 10%. And the risk of higher order multiples, like triplets or more, is less than 1%. There is also a chance the procedure does not work. The likelihood of success of an insemination cycle combining ovulation and induction is roughly 8 to 10% in couples with unexplained infertility. So how do you determine if you need or want an IUI in the first place? Ovulation induction with insemination or IUI is typically the first line for couples with unexplained infertility or for people trying to get pregnant using donor sperm. A couple is a candidate if at least one partner has sufficient ovarian reserve, one fallopian tube that's open, and a normal semen analysis. The chances of success with IUI declines after 3 cycles. Moving to IVF after failed IUIs has been shown to decrease the time to pregnancy, so we recommend re-evaluating if there have been more than 3 cycles that have not been successful. So what is the difference between IUI and IVF? In IUI, a sample of sperm is placed directly into the uterus at the time of ovulation, typically after a period of time where the ovaries have been stimulated with medication. IVF is a little bit different. Typically, you're using injectable hormones to stimulate your ovaries. Eggs are then retrieved from the ovaries under transvaginal ultrasound guidance, and then eggs are fertilized in the laboratory with sperm. The embryos are then allowed to grow and develop in the laboratory and then later transferred into the uterus. And so what about the outcomes? So a single cycle of ovulation induction with IUI has a success rate of about 8 to 10%. IVF, however, has a success rate of up to 60% when PGTA is also applied.